Did you know that by the time you finish watching this video, around 20 seniors will have been diagnosed with dementia? That's one every 66 seconds. But here's the truly terrifying part. What if the cause isn't simply aging, but something found right in your own medicine cabinet? For years, you've been told these pills are safe, routine, and even absolutely essential for your well-being. However, new research is sounding a blaring alarm, revealing a shocking truth. An astounding 99% of seniors have no idea that at least one medication they're taking could be shrinking key memory centers in their brain by over 28% in less than a year. Let that sobering fact truly sink in for a moment. What's more, the pharmaceutical industry has known about this for decades, yet they continue to profit billions from selling the very same drugs that may be accelerating cognitive decline in millions of seniors worldwide. In fact, a major 2023 study published in Neurology and Aging Research discovered that just one class of common drugs increased dementia risk by a staggering 49% in seniors within merely 2 years of use. In this urgent video, we will reveal the 9 most dangerous medications triggering rapid memory loss and dementia, ranked from those commonly ignored to the truly mind-destroying. You'll want to pay particularly close attention to number 3 on our list, which is prescribed to millions for something seemingly harmless, but it possesses the alarming ability to shrink key memory centers in your brain without you even having a clue it's happening. Before we dive into this critical information, we want to hear from you. What medications are you currently taking daily? And have you ever felt sudden brain fog or unexplained forgetfulness? Please share your experiences in the comments below, as we are reading every single comment and replying with personalized insights that could potentially save your mind. Don't stay silent. Your story might help countless others. Now, without any further delay, let's start our countdown at number 9, and don't let its position fool you. This medication is found in almost every senior's cabinet, silently scrambling your brain long before you even feel its impact. The 9th medication to be wary of is diphenhydramine, widely known as Benadryl. This is the familiar pink pill that millions trust to help them sleep, soothe seasonal allergies, or ease common cold symptoms. It's cheap, easily accessible over the counter, and quite likely sitting on your nightstand right now. You might believe you're simply taking it to sleep better or find allergy relief, but deep inside your brain, Benadryl can significantly disrupt the hippocampus, that vital region responsible for storing brand new memories. Benadryl belongs to a group of drugs called anticholinergics, which directly block a crucial neurotransmitter named acetylcholine. This chemical is absolutely essential for your brain to form new memories and maintain alertness. The older your brain gets, the more it relies on every single bit of acetylcholine it possesses. When a drug like Benadryl interferes with this delicate process, the results can be absolutely devastating. According to a landmark 2023 study published in the Journal of Geriatric Cognitive Health, seniors who regularly used anticholinergic drugs had a shocking 54% higher risk of developing dementia compared to those who did not. So, how can you proactively protect your memory? First and foremost, avoid anything containing diphenhydramine, especially if it's labeled PM, nighttime, or allergy relief, as these are often just Benadryl in disguise. If you rely on diphenhydramine for allergies, newer non-sedating options exist, such as loratadine, commonly sold as Claritin. These alternatives do not readily cross the blood-brain barrier and are significantly safer for long-term use in seniors. Remember, while you should never stop any prescribed medication abruptly without consulting your doctor, also never assume that simply because a medication is available over the counter, it is automatically safe for your long-term brain health. Up next is a drug often marketed as harmless and gentle on your stomach, yet it can crucially interfere with the very nutrients your brain desperately needs to stay sharp. Our 8th concerning medication category involves proton pump inhibitors, widely known by brand names like Prilosec or Nexium. These medications, or PPIs, are specifically designed to reduce stomach acid and are commonly prescribed for issues such as heartburn, GERD, and acid reflux. Many seniors end up staying on them for years or even decades because their uncomfortable symptoms quickly return as soon as they attempt to stop. What is rarely discussed, however, is how PPIs drastically interfere with the absorption of vitamin B12, a truly crucial nutrient that protects your brain and directly supports memory, focus, and mood stability. A significant 2016 study published in JAMA Neurology meticulously examined over 73,000 individuals aged 75 and older, discovering that regular PPI users had a startling 44% increased risk of developing dementia compared to non-users. By suppressing stomach acid too aggressively, PPIs impede the body's ability to absorb not only B12, but also vital minerals like magnesium and calcium, both of which are absolutely essential for neural transmission and proper brain cell signaling. Without these critical nutrients, your neurons struggle to fire efficiently, leading to misfiring, confusion, and memory lapses that often unsettlingly mimic the early signs of Alzheimer's disease. But the issue deepens even further. PPIs have also been definitively shown to increase levels of amyloid beta plaques in the brain. These are toxic proteins that directly disrupt brain function and are considered a core driver of Alzheimer's disease. The good news is that safer alternatives exist. If you're currently using a PPI daily, it's imperative to ask your doctor if you can slowly taper off with the support of H2 blockers like famotidine, commonly sold under the name Pepcid. While H2 blockers are not perfect, they are considerably less likely to interfere with cognition. Additionally, chewing a bit of deglycyrrhizinated licorice, a natural compound that gently coats and soothes the stomach lining, can often offer significant symptom relief without the risk of cognitive harm. The next medication we'll discuss is frequently taken for bladder control, yet it may be wreaking profound havoc on both your short-term memory and overall emotional balance. Coming in at number 7 are common bladder control medications like oxybutynin, often sold under the brand name Ditropan. This drug is frequently prescribed to seniors struggling with urinary incontinence or an overactive bladder. On the surface, it seems like a straightforward, practical solution. After all, no one wants to deal with the embarrassment or inconvenience of frequent urgent bathroom trips. However, this medication works by fundamentally blocking acetylcholine, the very same vital brain chemical that is also disrupted by drugs like Benadryl. And unlike some milder anticholinergics, oxybutynin crosses the blood-brain barrier much more easily, directly affecting the memory regions within the hippocampus. This makes it particularly dangerous for seniors, especially when used consistently over long periods. In a concerning 2019 study published in the BMJ, researchers found that individuals over 65 who took strong anticholinergic medications like oxybutynin for more than 1 year had a frightening 49% higher risk of developing dementia. That's nearly 1 in 2 users. What makes this even more alarming is that many seniors are never warned about these profound cognitive side effects. They are simply told it will help with bladder control, not that it may be accelerating mental decline. The ensuing harm is too often tragically mistaken for normal aging. Patients frequently describe feeling chronically foggy, forgetting appointments, habitually misplacing items, or suddenly struggling to keep track of everyday conversations. These changes are rarely linked back to the medication until the damage has already significantly progressed. So if you are currently taking oxybutynin and have noticed any unsettling mental changes, please understand it's not just in your head, and you absolutely do not have to stay on this drug to maintain control over your bladder. Fortunately, newer medications exist, such as mirabegron, sold as Myrbetriq, which work through an entirely different mechanism and have demonstrated significantly less impact on memory. These newer drugs do not block acetylcholine and are generally considered much safer for older adults. Our 6th medication on the list that warrants caution is statins. Statins are among the most widely prescribed drugs in the world, particularly for individuals over 60. They are primarily designed to lower cholesterol and thus reduce the risk of serious heart attacks and strokes, with simvastatin, Zocor, and atorvastatin, Lipitor being 2 of the most common varieties. But here is where the problem often begins to surface. Cholesterol isn't merely a heart health issue. It is an absolute necessity for proper brain function. Your brain is comprised of nearly 60% fat, and cholesterol plays an utterly key role in creating and maintaining the myelin sheath, a crucial protective coating that helps nerve signals travel smoothly and rapidly. When you aggressively lower cholesterol with certain statins, you may simultaneously be starving your brain of the very substance it requires to function optimally. A concerning 2023 study published in Frontiers in Aging Neuroscience found that seniors over 70 who had been on statins for more than 3 years had a 26% higher risk of developing mild cognitive impairment. Those on high doses experienced even more noticeable declines. What's even more worrying is that some patients reported sudden onset memory loss, vividly describing moments where they simply couldn't recall names, recent conversations, or even familiar driving routes. Now, it's crucial to understand that not all statins impact the brain equally. Some, like pravastatin and rosuvastatin, do not cross the blood-brain barrier as readily and are generally considered less risky in terms of cognitive side effects. If you've been on a statin for many years and are starting to notice brain fog, increased forgetfulness, or unusual confusion, it is truly time to have an in-depth conversation with your doctor about a potential dose reduction or exploring alternative strategies. Don't wait until any damage becomes irreversible. The earlier you take informed action, the better your chances of comprehensively protecting your mind for all the years yet to come. Moving on to number 5, we find benzodiazepines, which include well-known drugs like lorazepam, Ativan, diazepam, Valium, and alprazolam, Xanax. These are some of the most widely prescribed medications globally for anxiety and various sleep problems. They work by enhancing the activity of GABA, which is your brain's primary calming chemical, designed to reduce overstimulation. At first, they might seem like absolute lifesavers. They effectively quiet the racing mind, ease crippling panic attacks, and undeniably help with sleep. However, over time, these drugs transform into something else entirely, a subtle yet potent trap. A compelling 2022 study published in the BMJ meticulously followed over 8,000 seniors over a 6-year period and found that those who had used benzodiazepines for more than 3 months had a staggering 51% increased risk of developing Alzheimer's disease. This risk climbed even higher for long-acting benzos like diazepam, which remain in the body longer and accumulate more extensively in fatty tissues, including the brain. What occurs is a form of chemical sedation that fundamentally slows down all neural activity. This means your brain stops learning as quickly, it becomes significantly less flexible, far less efficient, and markedly more prone to confusion, disconcerting memory gaps, and an overall emotional dullness. Seniors on benzodiazepines frequently describe feeling like they are perpetually in a fog, feeling strangely disconnected from reality, or simply not themselves. The worst part of this cycle is when they attempt to stop. Severe withdrawal symptoms like intense anxiety, extreme agitation, and crippling insomnia can be so profound that they make the drug feel essential, when in reality, it is often the very source of the underlying problem. To rectify this dangerous situation, here is what you absolutely need to do. If you have been on a benzodiazepine for more than just a few weeks, do not stop suddenly. This can be exceptionally dangerous. Instead, work very closely and carefully with your doctor to gradually taper the dose. Gradual alternatives like buspirone, which is a non-sedating anti-anxiety medication, or exploring cognitive behavioral therapy for both insomnia and anxiety, can effectively help restore a sense of calm without tragically causing memory loss. At number 4, we have amitriptyline, also sold under the brand name Elavil. Amitriptyline is an older antidepressant that astonishingly is still commonly prescribed today for persistent pain, severe insomnia, and sometimes even chronic migraines. At first glance, it might appear to be a miraculous multi-use pill, but beneath the surface, it stands out as one of the most potent anticholinergic medications still in circulation. This means it aggressively blocks the action of acetylcholine, the very same critical chemical that enables neurons to communicate effectively, form coherent memories, and stay sharp. In fact, it blocks it so powerfully that the negative effects on cognition are not just possible. They are fully expected with any long-term use. In a massive 2015 study published in JAMA Internal Medicine, researchers meticulously examined over 3,400 adults aged 65 and older and found that those who took higher cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a horrifying 54% greater chance of developing dementia. That's not just a slight increase, that's more than half again the normal risk. What's truly terrifying is that many of these patients were never informed that this drug could fundamentally harm their memory. They were often initially prescribed amitriptyline for sleep issues or nerve pain, and then slowly began to notice disturbing changes like pervasive short-term memory loss, persistent word-finding difficulties, and a chronic foggy concentration. It doesn't even take a high dose to cause these serious problems. Even low-dose amitriptyline taken nightly over several years can insidiously create a slow, almost invisible erosion of your vital brain power. The damage frequently happens silently, with no immediate warnings or apparent symptoms at first, just a gradual, unexplainable decline that looks disturbingly like normal aging, but is, in tragic fact, drug-induced cognitive impairment. So, if you or a loved one is currently on amitriptyline, it is absolutely crucial to speak with a physician immediately about safer alternatives. For nerve pain, options like duloxetine or gabapentin may offer effective relief without the same severe level of anticholinergic burden. For sleep, melatonin or a low-dose doxepin, which possesses a much milder anticholinergic profile, can be safely used instead. And for vital mood support, there are much newer antidepressants like sertraline or escitalopram that are generally considered far safer for the brain's delicate chemistry. The third medication you must be aware of is paroxetine, commonly sold under the brand name Paxil. Paroxetine is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, used for treating both depression and anxiety. At first glance, it appears to be a modern antidepressant, one that's supposed to be gentler and safer than the older generation of drugs. But here's the crucial part they often don't tell you. Paroxetine is the only SSRI that possesses significant anticholinergic properties, which means it directly interferes with the essential acetylcholine in your brain. This single critical detail makes it drastically different and far more concerning than its SSRI siblings, like sertraline or escitalopram. In a comprehensive 2021 review published in Frontiers in Psychiatry, researchers meticulously examined the cognitive profiles of elderly patients taking various SSRIs and found that paroxetine users showed measurable, troubling declines in short-term memory, verbal recall, and attention span within just the first 12 months of use. The study also shockingly found that seniors on paroxetine were 30% more likely to exhibit early signs of cognitive impairment compared to those taking other antidepressants. The cruel irony is that it's often prescribed to stabilize mood, yet it ends up subtly undermining mental clarity and emotional regulation over time. The solution here is straightforward but absolutely essential. Avoid paroxetine entirely in seniors. The American Geriatric Society has placed paroxetine on its Beers criteria list, which is a rigorously maintained list of medications deemed potentially inappropriate for older adults due to their risks. If you are currently taking it, ask your physician immediately about switching to much safer alternatives like sertraline or escitalopram, which are generally better tolerated and do not carry the same devastating cognitive risks. In addition, supplementing with B vitamins, especially B12 and B6, can provide crucial support for mood naturally. Coming in at number 2, we encounter antipsychotics, and this category is especially alarming because many seniors, shockingly, don't even know they're taking an antipsychotic. Drugs like quetiapine, Seroquel, risperidone, Risperdal, and olanzapine, Zyprexa, were originally developed to treat severe conditions such as schizophrenia and bipolar disorder. However, today they are alarmingly and frequently prescribed off-label to elderly patients for common issues like sleep problems, general agitation, or vague behavioral changes often associated with dementia itself. That's right, these are incredibly potent drugs, meant for severe psychiatric illness, but they are increasingly being used in nursing homes and hospitals for seniors who are simply confused, restless, or perceived as hard to manage. The consequences of this widespread practice are utterly devastating. In 2022, a comprehensive study published in the Lancet Healthy Longevity meticulously followed more than 25,000 older adults and found that seniors prescribed antipsychotics for behavioral symptoms were a shocking 71% more likely to develop worsening cognitive decline within just 12 months, even if they had no prior history of dementia. Worse still, these powerful drugs significantly increase the risk of stroke, sudden death, and severe sedation, which can tragically lead to dangerous falls, urgent hospitalization, or permanent institutionalization. The mechanism behind this harm is brutal. These medications powerfully suppress dopamine, a crucial chemical that is not only intrinsically linked to mood and motivation, but is also absolutely critical for executive function and vital memory processing. When dopamine levels drastically crash, the brain becomes sluggish and profoundly unresponsive. This is why seniors on antipsychotics often tragically appear dull, emotionally flat, or disturbingly zombified. Their vibrant personalities frequently fade, and family members often begin to mourn someone who is still physically present but mentally distant. Correcting this horrifying situation begins with asking difficult yet essential questions. If you or a loved one is on one of these medications, urgently ask the doctor why it was prescribed and whether it is truly necessary for their condition. In many cases, behavioral symptoms can be effectively managed with compassionate non-drug interventions, such as creating structured daily routines, significantly reducing environmental noise and overstimulation, proactively addressing underlying pain or discomfort, and vastly improving sleep hygiene and lighting. When medications are deemed absolutely necessary, using the lowest possible doses for the shortest possible periods can significantly reduce harm. However, more often than not, these drugs are regrettably used out of convenience, not actual medical necessity. The true tragedy lies in the fact that many families are not even informed of what these powerful drugs do. They simply witness their loved one mysteriously declining without ever knowing the devastating cause is chemical, not simply natural aging. Finally, at number 1, we reveal the ultimate hidden danger: anticholinergic polypharmacy. This is the profound threat that almost no one truly talks about, and it is undoubtedly one of the single biggest contributors to drug-induced dementia in the elderly. You might have been expecting a single specific drug to top this crucial list, but the most dangerous medication for rapid dementia in seniors is not one pill. Instead, it's the silent, insidious, and creeping effect of taking multiple medications with anticholinergic properties at the exact same time, a truly perilous situation known as anticholinergic polypharmacy. Imagine this devastating scenario. A senior takes diphenhydramine for sleep, then oxybutynine for problematic bladder issues, and finally, amitriptyline for chronic pain. Each of these medications, taken alone, might only cause mild and perhaps overlooked memory problems. But when taken together, their individual effects combine and catastrophically compound, sending the cumulative anticholinergic burden skyrocketing to dangerous levels. This isn't merely a theoretical concern or a remote possibility. In a sobering 2022 analysis published in Age and Aging, researchers meticulously tracked over 280,000 older adults and found that those with the very highest anticholinergic burden had a terrifying 120% increased risk of developing dementia within just 10 years. That's more than double the normal risk. And here's the truly worst part. Most of these seniors had absolutely no idea they were even on anticholinergic medications. When you block the vital acetylcholine from multiple angles all at once, your brain doesn't just slow down, it profoundly begins to decay. Neurons wither from chronic underuse, delicate synapses shrink, and the brain enters a dangerous hypoactive state that unsettlingly mirrors advanced Alzheimer's disease. Correcting this does not require a miracle cure. Instead, it requires a diligent and thorough medication review. Ask your doctor or, crucially, your pharmacist to evaluate your entire list of prescriptions, over-the-counter drugs, and even seemingly harmless supplements for their anticholinergic load. There are readily available online tools and professional software that can precisely calculate this cumulative burden. Once identified, you can collaboratively work to deprescribe, meaning slowly tapering off any unnecessary medications, intelligently switching to safer alternatives, and rebalancing your brain chemistry with expert guidance. This is truly the most empowering and hopeful part of this entire video. Drug-induced dementia is often surprisingly reversible. When the medication burden is thoughtfully and carefully lifted, many seniors genuinely regain their precious mental clarity, lost energy, and vital memory function within mere weeks or months. Your brain is incredibly resilient, but only if you give it the proper chance to heal and recover. Anticholinergic polypharmacy is not just profoundly dangerous, it is also highly preventable, and that makes it the number one hidden medical threat to the precious minds of our rapidly aging population. Now, we genuinely want to hear from you directly. Which of these medications are you currently taking? Have you noticed any alarming brain fog, concerning forgetfulness, or unusual personality changes since starting a new medication? Are you willing to commit to talking to your doctor this very week about reviewing your medications with this critical information in mind? Please share with us your invaluable experiences and opinions in the comments below. We'd truly love to hear them and help foster this vital conversation. Thank you for watching this life-changing video.